Just over a month ago, Chrissy Tiegen shared on social media that she had suffered a miscarriage following a hospitalization for excessive bleeding during her third pregnancy. The celebrity shared very personal photos taken just after the heartbreaking loss of her unborn baby boy, who would have been her third child with singer John Legend. There was significant backlash online over how open Tiegen was about her miscarriage. So Marjorie is here with me now. Let's talk about pregnancy loss and why there is so much silence around it.
Hi Tracy. I'm not sure why it is so taboo, but it is. And when Chrissy Teigen came out and talked about it, and I actually saw her post on social media, I thought it was so raw and real. We at Inova felt the need to say something also, because I see patients who experience miscarriage because much as women seem to think that it's rare, it's not that rare. And women have a lot of guilt and shame and feeling broken, and they even attribute it to something that they've done. And there isn't a lot in the community to allow women to be open and talk about it. And the fact that she was criticized for it was just heartbreaking for me. So I think it's very important for us to have this forum to have the conversation.
I agree with that 100%. I think we carry around a lot of guilt. I've had a miscarriage before. I didn't really want to talk about it. And once I did start talking about it, you find that miscarriages are more frequent than you might realize. There are so many women that I spoke to that had also gone through the same experience.
Yeah, so like up to 50% of pregnancy can actually end in miscarriage, and miscarriage is actually the loss of a pregnancy or fetus before 20 weeks of gestation. So it's early on in pregnancy. 80% of miscarriages actually happen before the end of the first trimester. And women are actually programmed, like regularly women will say when they get pregnant, my fertility patients work really, really hard to get there, but understand that miscarriage is common and won't even talk about being pregnant until they're 12 weeks because they understand that there's a high risk of loss before the first trimester. We as a society have grown so accustomed to kind of pushing down this idea of miscarriage that women won't announce pregnancies until 12 weeks for fear of it happening and not having to make people uncomfortable about it.
We know that there isn't sort of, a blueprint as for what is happening every time, but can you go through a list of what might be happening in your body when a miscarriage takes place?
Right. So a miscarriage is just one miscarriage where your pregnancy lasts before 20 weeks. But recurrent miscarriage is where women have two losses before 20 weeks, and that happens to some women. So we, as a fertility specialist, reproductive endocrinologist, I go through a systematic list. Most common cause, 70% of the time, genetics. So there's something called a Robertsonian translocation or reciprocal translocation, more information than you need, but the chromosomes don't line up. It doesn't make a healthy genetic pregnancy, and women don't hold on to it. That's one. There are hormonal imbalances. That's another. Issues of autoimmunity, if there is something like lupus in your family or rheumatoid arthritis or other autoimmune disorders, you can be predisposed to it. That's one of the etiologies or reasons. There can be clotting factor disorders, so the placenta doesn't have good blood flow between the maternal fetal or mom and baby interface, and therefore the pregnancy doesn't maintain itself. Infections can happen. 40% of the time, we don't know. It's a random, unfortunate happenstance, and women are left holding these emotions and having no recourse. So, as you said, talking about it and understanding that there are other women who go through it, I think it's so critical to find supports for women. I see patients every day, and that's the most devastating part, feeling alone and feeling like you don't want to talk about it, or that when you talk about it, people say just not great things to you, right?
Before we go, it's really important that people know that you need to hold space for people to have these experiences and try not to step in it. I had a friend that came back to work after going through a miscarriage and no one said anything, and that was the wrong move. And she told me that. She's like, everyone's pretending I wasn't even pregnant. What can you say to someone who has gone through this, if you're in the work environment or even if it's a family member? Any advice?
Yeah, validate, encourage support. Don't say stupid stuff. I know that's probably not a very doctor thing to say, but don't reassure people, well, at least you got pregnant, or well, at least you have another child. Those are asinine things to do. Give people their space. Say, like, I'm sorry for your loss. It's a loss. People grieve, right?
Yeah.
So I'm sorry for your loss. If I can be of any help, let me know. Validate people's emotions. Don't tell them you'll get over this. In no time, you will have forgotten again. Not a wise thing to say. If someone had died, you would not tell them not to worry about it.
Mm-hmm.
This is a real loss. Families name their infants, family name their embryos from early on. And people can get judged for that. Look at Chrissy Tiegen. It's not okay. Women need supports. Women need strength in talking about it. If it's happening to 1 in 4 women, it is common. We can't keep calm, carry on. We have to support one another. Pregnancy and infant loss networks exist. Go online, find support groups, help women to talk it through. We can't shove it down. It's not okay.
Dr. Marjorie Dixon, thank you so much for this very important reminder.